Enter week 3 and there appears to be no let-up in the health workers' strike in some counties. Instead, the standoff between the national government and the county governments is heating up. The chair of the Council of Governors, Peter Munya, now dismissing a warning from Health CS CS Macharia, issued last week cautioning devolved units against mismanagement of the health sector, hinting that the government might be forced to revert the function back to the national government.
2.5 years, we've been tolerant. We've been seeing how we can help the county governments to improve healthcare. But of course, there's a limit. You know, if there's total collapse, you don't just sit back and say, we do nothing. Yeah? Not just ourselves, but even Parliament has a duty.
He needs to understand that he's not in charge of health in the counties. He's not a supervisor of county government. He's not. He doesn't have any supervisory role for the counties. And we don't need any opinions and advice from him on how to run counties.
Munya claims that the comments made by the CS betray the national government's agenda to portray the counties as having failed to provide healthcare, arguing that the sector is at its best being managed by the county governments.
Compare our record of 3 years with the record of 50 years. When the national government was concentrating doctors, 300 doctors were working at Afya House, pushing papers. Is that where they want us to return?
During an exclusive interview with Citizen TV, CS Macharia accused the governors of perennially seeking excuses for the continued financial mismanagement by blaming the national government over delayed funds.
Delays in submitting the money, it will mean the entire 47 counties are in problems. But you hear the same voices. Yeah, you can count maybe 1, 2, 3, 4, up to maybe 6 voices, common voices. Other people are just working and happy.
Munya, on the other hand, wants the Ministry of Health budget be slashed to increase funding to the counties.
Macharia, he runs only 2 hospitals. Kenyatta Hospital and Moi Referral Hospital. Why does he need 200 billion to fund which sector? Because he's not in charge of any sector.
Esther Kahumbi, Sunday Live.